So what I would like to talk about is a bit how gentle homeopathy is, that it has no serious side effects, although you can sometimes get an aggravation before it gets better. It therefore can be used in babies, in pregnant women, in elderly patients. Very frequently I get patients who have tried the conventional routes and had years of conventional investigations and treatments and haven't got anywhere with it, and come here, and frequently a fairly straightforward homeopathic prescriptions can make a big difference to them. Homeopathy is always put down as a placebo effect. I have seen in my practice that babies get better who have no idea that they are taking homeopathy. I have recommended to pet owners to use some homeopathic medicines and they got better. I know of studies where whole herds of animals have been treated. They certainly do not know what they're taking and it had positive outcomes. I've had some very heavily disabled patients who don't even know that they're in the clinic room and certainly have no idea that they are taking homeopathy. So I don't feel the placebo effect is a valid argument. And the French Nobel Prize winner Luc Montagnier has spoken out in the magazine Science that high dilutions of something do have an effect and that it is a phenomenon which deserves further study. At the moment, we don't need to know why it is working. If you do practice homeopathy, you see daily in your clinic positive results, and as I said before, many outcome studies have shown very positive results. I sadly have many patients who come to me but do not want their GPs to know that they're taking homeopathy and won't tell their GP that they actually got better on the homeopathic prescriptions. So I very much feel that as we are paying for the NHS with our taxes, that patients should be given a choice and be able to choose the treatment they want for themselves and for their family. And it shouldn't be dictated by people who are closed-minded and haven't examined homeopathy deeply. Ideally, I would like to see that homeopathy is more integrated into the health system, that homeopaths and conventional practitioners work together, that we choose the best treatment for the individual patient, that we partially combine conventional medicine with homeopathy, and that there is more openness between the two medical systems. It's sad that it's only people who can afford it. I have got a colleague who worked as a GP for many years, and she was a fully qualified homeopathic doctor as well, and integrating homeopathy into their practice saved the GP practice a lot of money and patients got healthier. Her colleagues referred patients to her where they felt they couldn't get any further, and she could often achieve improvement with homeopathy, and it had a very positive effect on the costs of the GP practice. I know that we have a massive public health crisis. We've got more and more chronic disease, an aging population, health costs are spiraling out of control, and homeopathy could provide a big service if it is more integrated into the health system to drive down costs, to decrease chronic diseases.